Hello, everyone. My name is Kevin, and I am a acupuncturist working at Center of Balance, based in Dinsdale, Hamilton. And I am doing a daily live talk. And today's topic is going to be ankle pain. I don't know how many of you out there experience ankle pain. Probably most people in their lifetime would have had some type of pain in the ankle due to maybe sprain. You know, when you're walking, maybe you sprained your ankle, or you're playing sports, or something that triggered pain in your ankle. So it is. I guess it's very common to a common symptom or illness that occurs in most of us. Okay. So today's talk is going to be discussing ankle pain through the lens of Western medicine as well as Chinese medicine. Okay, so we will get started now. So, ankle pain is a common symptom. And when ankle pain is mentioned, many people first reaction is an ankle sprain, especially when playing basketball. Some people will get ankle sprain, and so many people experience this. You know, when you're playing basketball, you sprain your ankle. In the case of ankle sprains, everyone will go to the doctor. Some doctors believe that ankle sprain can be treated from the directions of, bones, ligaments, tendons, and nerve problems, and biomechanical issues. Okay, so some doctors, they believe we just need to look at those elements, okay, and then we can treat ankle pain. And modern medicine has been very thorough in the analysis of ankle structure. So here today we will discuss the lateral and anterior side of the ankle. So what happens when you have pain on the lateral, which means the side, anterior means the front side of your foot. Okay. So from modern medicine's perspective, ankle pain is often caused by ligament sprain or tendon strains. Excuse me there. So nearly 70 to 80% of the sprains occur on the outside of the ankle. People who like to play basketball knows this best. It usually takes around 2 to 3 months to heal. So it is not a little thing. It can really affect you, although the joint may look insignificant. So if you have an ankle pain or ankle sprain, the modern hospital will check whether there is a fracture, a sprain of the lateral ligament, or a sprain of the posterior ankle ligament, and then determine whether the severity is mild, moderate, or severe, and they will treat accordingly. Anterior ankle pain is likely to be caused by edema of the ankle or tibial tendonitis or bone spurs. After a serious sprain of the ankle, usually will cause surrounding pain in the ankle joint, which means the anterior, the medial, the inside, and the posterior, the back. Okay. In this case, the likelihood of edema in the ankle is relatively high. When the tendons of the tibias are abnormal, the pain may also travel to the anterior side of the ankle. Bone spurs of the cuneiform bone, which is located on the arch of the foot. So the cuneiform bone is around this area here on the arch of the foot. So this is arch, you can see. Yeah. Usually, this is caused by friction and can also result in pain on the front side of the ankle. Okay, so in today's world, in the modern world, when people have ankle pain, they will usually not go directly to a bone specialist. In China or in Taiwan, we have this place called 国术馆, okay, where if you have any fractures or broken bones, sometimes they go to 国术馆, they can put the bones back, and it is the I guess you can say it's the traditional type of traditional Chinese bone doctors, I guess you can call them. So they mainly deal with any broken bones, or if you have traumas, or if you're due to injury, something is sitting out of alignment, they'll put things back in. So these days, people don't usually just go to one of those places, but instead, they will obediently go to the hospital to take x-rays and get examinations and receive treatment from the modern medicine. If the pain is caused by slight sprain or even no sprain at all, we can actually try to understand the cause of ankle pain from TCM's meridian perspective, using the meridian theory to understand how the ankle pain came about. Because it is easy to say, okay, I played basketball and I had a sprain and my ankle is swollen. And it's probably really obvious that when you take an x-ray, you'll be able to see some abnormality, or when you take a CT scan, you'll be able to see some swelling or something out of place. But what if you just had ankle pain for no reasons? And so nothing's out of place, nothing's out of alignment. You did not play a sport or sprain your ankle. You just the pain just happened to be there. What do you do? So this is where Chinese medicine is really useful, because it has another theory called the meridian theory that we can use to treat the pain. So to understand the pain on the lateral and anterior side, lateral means the side and anterior means the front of the ankle, we need to explore which meridians pass through these locations. So don't underestimate the ankle area, because many meridians actually runs through this location. The lateral side of the ankle, the outside, is mainly the gallbladder meridian and the bladder meridian. So have a look. You have the gallbladder meridian that runs through on the second to last toe, all the way in up the side of the ankle, up to your side of the leg, up the side of the leg, and travels up, zigzags across, and then up to the head area. Okay. Finishes on the head. And then you have the bladder meridian, which also starts from the side of the foot. Okay, and then up this way. And again, it's on the lateral side of the ankle, and then goes to the back of the leg, travels upwards into the back, and up the head, and finish on the head. Okay. So the anterior side is the stomach meridian and the liver meridian. Okay, so the stomach meridian begins on the side, on the lateral side of your second toe. Okay, so in the middle here, and travels up. You can see this green line travels up the front. So actually, you can see it runs through the ankle, the anterior side of the ankle. Okay, runs upwards into the tummy, up the chest, onto the face as well. And then you have the, what did I say? The liver meridian, which runs from the side of your big toe. Okay, the lateral side of your toe. Lateral means the outside, not this side. Okay, so the lateral side of your toe upwards and sort of goes on the inner side of the leg, travels to the groin area, and all the way up to the abdomen area, just below the rib cage. Okay, so and then you have the inner side. The inner side of the ankle, you have kidney meridians and spleen meridian running through them. Okay, so kidney meridian starts from the sole of the foot, so all the way from the bottom of the foot, and travels up posteriorly and runs. Can't see it very clearly. Okay. So, okay, and goes up, sort of close to the center of your body, the torso, and all the way up. Okay, so that's the kidney meridian, and then you have the spleen. Did I say? Yeah, the spleen. The spleen meridian is from the medial side, which is the inner side of the toe, and travels this. You see this green line here? It travels up here. Okay, and all the way past the groin area and on to the torso area. Okay. So there you go. So the ankle of the body of the ankles are actually surrounded by 6 meridians. You have lateral side, you have gallbladder, you have bladder meridians. At the front, you have stomach meridian, and liver meridian. And on the inside, you have kidney meridian and spleen meridian. Okay. So when a person's ankle is sore or painful or sprained, that means these meridians are also involved, and maybe they're also injured. That's why they're painful. So if the lateral and anterior pain of the ankle is discussed from... okay, so sorry, I just read the wrong part. So is it possible that there is no sprain, but you still get ankle pain? It is definitely possible from the perspective of the meridians. And the most common reason is that the gallbladder meridian and the stomach meridians are injured. So the gallbladder is on the side, stomach meridian is on the front. So this is why a certain percentage of people have pain on the outside and anterior side of the ankle without any sprains. On the other hand, if these meridians are often in a state of weakness of qi and blood, so if they are malnourished, these meridians do not have enough qi and blood to create smooth flow, okay, on the meridian lines, the muscle and tendons cannot be nourished, and therefore sprain is more likely to appear due to weakness of the joints. The reason why I say if your stomach meridian and gallbladder meridians are weak, then your muscle and tendons are likely to be malnourished. This is because the muscles are actually, our muscles throughout the entire body are actually governed by the stomach and spleen. Okay? So if your stomach and spleen are not strong enough, they cannot digest the food properly and turn them into fine nutrients for our body to absorb. And therefore, our muscles cannot be nourished by the food essence, okay? So this is why in traditional Chinese medicine, we believe that the muscles have a direct relationship to your muscle, to your spleen and stomach. And the tendons are actually associated with the liver and gallbladder. So if you often get sore shoulders, tight shoulders, tightness of your joints, okay, or find it very hard to stretch, these are all because your tendons are not nourished. And the tendons are not nourished because the gallbladder and liver are not strong enough and unable to nourish the tendons and ligaments. Okay? And when these muscles and ligaments and tendons are not nourished for a long period of time, they become weaker and weaker as we age. And if they're weaker, then they're more prone to injuries. Okay. So when the ankle pain is associated with the foot 3 young meridian, what are the 3 young meridians? So the 3 young meridians are the one, yang in Chinese medicine means the outside, the visible side. You can see, yin is the hidden side, on the inner side, yeah? Yin, just remember inner, yin, outer, yang, it's easy to remember. So there are 3 meridians on the outside, on the stomach meridian, the gallbladder meridian, and the, and the bladder meridian. These are the 3 young meridians. So when the ankle pain is associated with the foot 3 young meridians, it is also likely accompanied by symptoms such as dizziness, headache, lower back pain, poor appetite, easily fatigue, frequent urination, calf cramps, cold intolerance, gastroesophageal reflux, nose water. So why dizziness and headaches? It's because the liver is also can cause dizziness. If the liver is not strong enough, it's deficient, it can also cause dizziness. Or if the liver and gallbladder is hyperactive, it also tends to cause dizziness and headaches. And lower back pain is associated with the bladder meridian, because you see the bladder meridian goes from the side of the foot all the way up the back of the leg and onto the upper back and lower back and up the head. So the bladder meridian is actually a very big meridian system. So when your bladder meridian is in trouble, then you often would also experience lower back pain and upper back pain. Poor appetite, and that's because if you have poor appetite, that is obviously related to your stomach. Stomach is not happy, it's not hungry, it doesn't want to eat, it doesn't have appetite. And if you don't have enough food, you're lacking in energy, and therefore you get easily fatigued. This is why tiredness, not having any energy, is also associated with the stomach. And calf cramps, like I talked about, that is also related to the liver, the tendon and ligaments, and which is associated with the liver. And cold intolerance, so if you are feeling cold all the time, that means you have a lack of energy, and that's associated with the energy. Energy is associated with food. Food is associated with your stomach and spleen. Gastroesophageal reflux. So you have heartburn all the time. That's also associated with your stomach and spleen. So So what happens if you don't take care of your ankle problems? If you have pain in the ankles, you never get it treated, you sort of ignore it, then what will happen is a chain reaction in the future. Maybe you won't feel it now, but in the future, 10, 20, 30 years time, other symptoms will start to appear, such as if the pain was on the outside of your ankle, and then it becomes pain on the inner side as well. It may cause your hip to be lopsided, so one side higher than the other one, because you're in pain most of the time, and so your body is not working. It's trying to so when you for example, if your left leg is compromised, then you'll be using your right leg more, and then causing the right leg to be stronger, have stronger muscles, and therefore it causes a muscle imbalance, and therefore affecting the structure, the hip structure. You're also more likely to develop lower back pain, as I said before, and scoliosis or kyphosis, the spine bending different ways. You're also more likely to develop knee pain or even shoulder pains. So these are all chain reactions that can be caused by ankle pain. Okay. So therefore, I have to emphasize, every time you had an injury in your ankle, please don't ignore it. It's better to sort it out immediately, get the tendons healthy again, the muscles healthy again, the ligaments healthy again, and to avoid future complications. Okay, so today I will give you a couple of tips on how to manage your ankle pain using the meridian system, and these ones you can use them at home. So if you feel ankle pain or you've got a sprained ankle, you can use these immediately. You can think, okay, my pain is on the lateral side of the foot. Okay, what meridians is it involved? Is it associated with? The answer is the gallbladder and the bladder meridian. Yeah. So what are some of the pressure points or acupoint we can use to help alleviate your ankle pain? Okay. So one point I would like to teach you is called Yangling. Okay. Yangling is actually located on if you find your knee, okay, so if you bend your knee like this, here is the lower side of your kneecap, and then if you draw a line across, and then on the side you can actually feel there's a bone here. Yeah, you can feel there's a bone here, and then this point is under the bone and in front a little bit. So you should feel a slight depression and a little bit sore to the touch. Okay, so we say under the fibula bone, the head of the fibula, inferior, posterior. Inferior means under, posterior means front. So this is the point where you find Yangling. Okay, and give that point a good 30 seconds to a minute rub, and you can start to feel, the side of the foot, the side ankle, the lateral side ankle, it's beginning to have some sensation or beginning to free up. Okay. The other point I like to teach you is called 足三里. Okay, 足三里 is also very closely associated to, closely located to Yangling. 足三里, the easiest way to find 足三里 is around 4 fingers width at the bottom of your kneecap. Okay, so you find the kneecap, the bottom of the kneecap, it's about 4 fingers under and you can feel that there's a tendon here, quite a strong tendon here. And if you go forward, and then you feel bone here, your shin bone is right here. Yeah. So the point is around 1 finger width from your shin bone. So 4 fingers down from your kneecap, and 1 finger lateral to your shin bone. And that is 足三里. So that's on the stomach meridian. Okay. So give that a good 30 seconds to a minute rub. Yeah. You can either use your thumb or your hand or your massage tool. And that can, you might be surprised what it can do for your ankle as well. Okay. Another point you can do for if the ankle pain is at the back, it's more on the side here, on the side of the foot, okay? Okay, on the side of the foot here. You can find a point at the back of your leg, right behind the knee. There's actually 2 tendons here. Okay, 2 tendons here. And in the middle between the 2 tendons is actually also right in the middle behind your knee, okay? So this point is called 尾中, which is on the bladder meridian. If you press this point, give it a good rub, okay? Like 30 seconds to a minute, then that can help alleviate any problems on the bladder meridian. Okay. Okay, that's it for today. I hope my tips will help you manage your pain in the future. If you have an ankle pain, give it a try. And if you have any questions, please don't hesitate to ask us. My name is Kevin from Center of Balance from Dinsdale, Hamilton. And please give us a call if you have any questions. Our number is 07846 7956. We'll be more than happy to help you with your health problems or your queries. Or if you know anybody who needs a treatment or could benefit from acupuncture or Chinese medicine, herbal medicine, please also send them our way. We can help them. Okay, thank you very much for listening, and I hope you will enjoy your weekend and happy life and a good prosperous future, I guess. See you. Bye.